One of the things that's helped me stay injury-free is regular visits to my physiotherapist and chiropractor at Active Back Care. My name's Hugo, and in this video, physiotherapist Evan Adair is going to teach us some injury prevention and treatment tips for rock climbers.
Hugo, coming through. Come on in, take a seat.
So Evan, tell us a bit about yourself.
Yeah, so I have an undergraduate in Bachelor's of Sports Science, and then I did my Master's of Physio after that. And then I've been working here at Active Back Care for the past year now. In terms of my sport background, I played a lot of soccer growing up as a kid, and I do regular gym work as well. But one of the things that got me interested in rock climbing in particular was that I climbed for about 4 years previously, quite intensely, about 5 to 6 times a week. I don't do it as much now because I'm a bit busier at work, but I still enjoy getting onto the wall here and there.
So what are the most common injuries in rock climbers?
Yeah, so a study came out actually a few years ago that looked at the most common injuries in rock climbers, and they found that 35% of all rock climbing injuries that were reported were finger tendon injuries. Pretty understandable. They're the things that cop the most when you're on the wall. Second to that, about 10% of injuries were elbow-related injuries. So you're looking at like your tennis elbow and your golfer's elbow. And then from there, it moved up into the shoulder. Another 9% of injuries coming from the shoulder. And the rest of them were just spread out all over the body.
So what are the best exercises to do to prevent those injuries?
Yeah, so when it comes to the fingers in particular, the best thing to do is just to gradually load them, okay? To go from not climbing at all to all of a sudden doing a bunch of crimps and a bunch of really small finger pockets aren't going to bode well for your fingers, okay? One of the things with tendons in particular, which is all the things in your fingers are just really tendon. There's not much muscle there. One, there's not a lot of blood flow down there. It's quite poor because it's the furthest away from our heart. But two, tendons take a long time to heal and recover compared to muscles. Okay, so we have to load them and adapt them much more gradually. So if you're thinking about doing crimps or a harder climb that you haven't done before, gradually expose your fingers to more load. Okay, so pop onto a hangboard, mimic the hold that you want to train for, and start exposing your body to that over a period of time. And one of the key things is to take regular breaks between those training sessions to give time for the tendons to adapt. In terms of elbow and forearm kind of thing, kind of injuries, it's a similar thing. Try not to overload is the best thing. When you are training, doing things like isometric forearm wrist extension and wrist flexion is really important to help, again, gradually load the tendon. Because what happens is our upper body isn't used to experiencing load in the same way that our legs are and our backs are from jumping and walking. So when we get onto a rock wall, which we're not really designed to do, our tendons freak out. And so the best thing to do is just gradually expose them to load over time. And then as for the shoulder, one of the big things we find is rotator cuff tears, which is the muscles that help stabilize your shoulder. Obviously, when you're climbing, your arms are in these positions a lot, often overhead, and you're putting a lot of weight through there, supporting your weight through your back and your shoulder. So the best thing to do is rotator cuff exercises, particularly though in those overhead positions, okay? Doing things like weighted dumbbell rows from here, things like single arm lock-offs and that sort of thing on the hangboard, stuff to train your stabilizing muscles to do their job better.
What other precautions should climbers make in their training?
Yeah, so as I mentioned before, trying not to overtrain is a really big thing. Training, if you're adapted to climbing and you've been climbing regularly, then you can continue doing that and that's fine. But if you're specifically training certain tendons to experience more load, then you should be taking regular breaks. As well as that, if you're attempting a new climb or you're trying a harder climb than you're used to, know the holds that you're about to climb on. If you're unsure of what a hold looks like or feels like or how you should approach it, you should test it first, just have a feel of it, try and gauge an understanding of what it's going to take for you to hold that hold. Otherwise, you're at risk of putting your body into a position that you're not prepared for physically or mentally, and that's where injuries can happen. Another thing is obviously warming up appropriately. Starting on some smaller climbs, easier difficulties, getting the muscles firing, getting them warm, and then also making sure that your wrists and forearms are nice and mobile and stretched out. Those would probably be the big things to help prevent any injuries.
And if someone's already got an injury, what's the best thing to do?
Yeah, so the best thing to do, first and foremost, is to see a physio. A lot of people tend to try and self-diagnose, or they go to someone who's had an injury before who's told them about it. But the reality is those people might not know your individual circumstance, and what a physio can provide is expert diagnosis and understanding of the body and give you a good time frame and sort of an understanding of what to expect for your recovery. So that should be the first step. Second step is to then follow their instructions and make sure that you're doing your rehab and the exercises they instruct you to do to get you back on the wall faster. In terms of personal stuff to manage injuries, if you're coming back from an injury, similarly again, exposing your body to load. Okay, so getting on the hangboard and doing things that are pain-free and gradually building back to what you were doing before. Don't just assume because the pain is gone, because you've been out of climbing for a few weeks and the pain's settled, that all of a sudden you'll be able to jump back to what you can do. Start light and do what's pain-free and do it gently and gradually build back up to what you're capable of doing. Another thing that you can do is taping. Taping's a really important thing, especially when you're coming back from an injury. As I said, tendons take a long time to heal and they take a long time to adapt. And so if you have a tendon tear or a tendon injury, having something tape or braced can just give it that little bit extra support and give you that little bit of extra confidence that you need to get back on the wall. Obviously, it shouldn't be something that you feel required to wear all the time, and it should be something that you continue to wear even after the injury settled for a short amount of time, but it shouldn't be something you maintain unless you're doing extreme climbs and you're at that high-end level of climbing. Taping fingers and shoulders are obviously very different, and it depends on your needs and your wants. So if you have a shoulder injury or a rotator cuff injury, one of the things we want to try and do is get the shoulder head here, okay? Often what will happen if the rotator cuff is injured, it'll fall forward like that. And so we want to tape to help pull that back. Now you can do that with rigid tape, okay? So sort of the stiff brown tape, but often that doesn't give a lot of movement. It's quite restricted, and when you're climbing overhead and in lots of awkward positions like you are often on the wall, it can make things really hard and uncomfortable and often actually cause more harm than good. A simple way to do it for the shoulder is using something like rock tape. It's got a bit more stretch, it still pulls your shoulder back, but it gives you that mobility without providing too much restriction. With the fingers, what we want to be doing is making sure that we're not, taping any fingers together or anything like that to give it extra support, but what we're doing is just sort of taping to try and make sure that the tendon doesn't bow out. Okay, so what happens is often when we crimp, ideally we want to be in that sort of position, getting a nice smooth rounding between all the tendons. What often happens though, especially with the high-end climbers, they tend to do that, shove their thumbs right down, and you get really sharp angles at all the joint spaces, okay? What happens then is that between each of those joint spaces, the tendons bow out. So they sort of come out there and out there. And so by taping, holding those in, it just provides that bit of extra security, stops those tendons from bowing and getting under too much stress, and therefore hopefully prevents them from breaking.
Thanks very much, Evan. Well, I hope you found that as helpful as I did. If you want 25% off your first appointment at Active Back Care, make sure to use the code HUGO18. Thanks very much for watching. Please like and subscribe, and I'll see you next time.